According to the CDC, lung cancer remains the leading cause of death from cancer in the United States today. Although recent advances and cutting-edge treatments have improved outcomes, the importance of finding and diagnosing lung cancer in its early stages remains a common denominator in the battle against the disease. Today, how the precision of robotic technology is paving the way for early lung cancer detection. I'm Olga Villaverde. Access Health starts right now. Lung cancer is a fairly new disease of the developed world. In fact, 150 years ago, it was considered an extremely rare disease. According to studies in 1878, malignant lung tumors represented only 1% of all cancers. At the turn of the 19th century, with the introduction of environmental pollutants, chemicals encountered in certain occupations, and the rise of tobacco use continuing into the late 60s, the incidence of lung cancer peaked to its highest numbers in the mid-80s. The good news is those numbers have been on the decline. Research indicates that it's due to more people quitting smoking, never smoking, and medical advances in diagnosis and treatment. Dr. Ali Abedi is an interventional pulmonologist at Texas IPS with a focus on the management of lung cancer and thoracic oncology.
Lung cancer at this point is the #1 cancer-related cause of death in the United States, owing to the fact that over 70% of patients who present with lung cancer do so at later stages where the disease has already grown beyond levels where we can offer a cure. One of the challenges in managing lung cancer is that in its very early stages, symptoms are really typically not present. As tumors in the lung continue to grow, some of the symptoms that people might expect to have are related to the local effects of the tumor on the lung tissue around it, which can result in coughing, coughing up of blood, chest pain in some instances, and then shortness of breath that can develop. And eventually, if the disease becomes widespread, symptoms can be related to any part of the body that it spreads through at that point.
My name is Felbaum. I've been married for 21 years to my beautiful wife, and we have 3 children. We live in the hill country outside of San Antonio or south of Austin in a little town called Spring Branch. And it's a small, tight-knit community, and it's peaceful. Our family are active in the church. We love the outdoors. There's not much that we don't do as a family. A few years ago, me and my boys got scuba certified. Since then, we've done over 30 dives. And it's just an awesome adventure to be able to do with them, to experience scuba diving, the underwater world, and the weightlessness and the freedom. That's my happy place. My wife and I are doing some remodeling, and I was working, and then I would get dizzy. I would let some time go by. You know, I'd rest up. I didn't really think that much of it. Unfortunately, about a week later, I started getting dizzy again. And I started getting frustrated with it because there were things that we wanted to get done.
He was struggling. His natural disposition is to just work through it, to not show weakness. But there came a time when none of that was enough. I kind of hinted it was time. It was time to go see somebody.
The typical at-risk population for lung cancer are individuals who have personal history of smoking, especially if you smoke significantly, so the equivalent of more than 1 pack per day for more than 20 years. And if that amount of smoking is associated with lung disease that we can identify. In addition to that, having a history of primary relatives who also have had lung cancer in the past increase your risk based on the fact that it suggests there's genetics in your family that predispose you for lung cancer, as well as exposure to certain harmful chemicals like radon, chemical fumes, as well as having had a personal history of cancers in the past that would also increase the likelihood that you will have other cancers in the future. But anybody can really be at risk for developing lung cancer, and what we're seeing over the decades is that more and more patients who've never been smokers can develop lung cancer, and at this point, up to 20% of patients who present with lung cancer had never been smokers at any point in their life. This is what makes it very important for us to focus on identifying individuals who are at risk for lung cancer and putting them in appropriate screening protocols, because with a disease that doesn't typically have a lot of symptoms in its early stages, it becomes very important to actively go and look for it before it's had a chance to declare itself.
The USPSTF recommends annual screening for lung cancer with low-dose computed tomography in adults aged 50 to 80 years who have a 20-pack year smoking history and currently smoke or have quit within the past 15 years.
Studies show that early detection of lung cancer by incorporating low-dose CT scans can reduce the mortality of lung cancer by up to 20%. But unfortunately, despite knowing this, currently less than 7% of patients who qualify for lung cancer screening are currently being enrolled in these programs. Getting screened for lung cancer isn't something that's going to increase your likelihood of having lung cancer. It's going to allow us to detect it if it happens to be there. Almost 40% of patients who have lung cancer screening CT scans done do end up coming up with an abnormal finding, but typically 96% of those findings end up being something other than lung cancer.
So these symptoms that I was having lasted about 3 weeks, and finally I decided I'm going to go to the urgent care. Of course, I told the doctor all my symptoms, and we couldn't find anything. The doctor, knowing that I used to have a history of smoking, he ordered the chest x-ray. And when that chest x-ray came back is when they found a spot in my lung.
Coming up, how technologies are enhancing lung cancer care. According to the American Lung Association, every 2.5 minutes, someone in the United States is told that they have lung cancer. If it is caught before it spreads, the likelihood of surviving 5 years or more improves by over 50%.
So then I went to my primary care doctor, and he agreed that additional testing needed to be done. And once the PET scan came back, he was very suspicious. Both my parents passed away from cancer. My grandfather passed away from cancer. And it was fast for them. And I couldn't help but think that it was going to be fast for me as well. You just can't imagine, the different thoughts that are going through your mind. And the thought of not being able to continue these same experiences, the camping, the scuba diving. If I have lung cancer, am I going to be able to scuba dive with my boys again?
A pulmonary nodule is an area of lung tissue that's more dense than the normal lung around it, and it can represent an area of scar from a previous infection or injury. It can represent a benign tumor, which is basically a collection of normal tissue in an abnormal spot, or it could represent a malignant process such as a lung cancer or cancer from another part of the body that spread to the lung. So these findings can be fairly common. Up to 40% of the time when we do obtain CT scans for lung cancer screening purposes, we do find nodules, and only about 4% of those nodules actually end up being diagnosed as lung cancers.
My primary doctor told me I needed to see a specialist. He was directing me to Dr. Arbetti. And when I went and saw Dr. Arbetti, he explained the results of the PET scan, and that there was a nodule that needed to have further investigation. So he was ordering a biopsy of that.
Coming up, a minimally invasive approach for biopsies in the lung. We'll be right back. There is no lack of evidence that lung cancer outcomes have historically been dismal, but there is also proof that detection of these tumors in the early stages can lead to improved prognosis for patients. In fact, some studies are showing that early detection can reduce the risk of death by about 20% among high-risk populations.
Although the characteristics of the nodule on a CT scan, as well as functional imaging like a PET scan, in the context of the patient's risk factors for having lung cancer, can certainly raise the suspicion that a nodule represents a lung cancer, the only way to know definitively is to perform a biopsy where we can obtain tissue samples of this nodule to confirm that we are in fact dealing with a lung cancer. The most invasive route includes doing a surgery to cut out the area of lung that includes this nodule. A less invasive procedure is a CT-guided biopsy where we puncture the lung from the outside under direct CT scan imaging to be able to get a piece of the target. CT-guided biopsies are less invasive than surgery, but they still involve the process of puncturing the lung with a needle from the outside, which means that in up to 1 out of every 5 times that we perform this procedure, we could cause a large enough hole in the surface of the lung that the lung can actually collapse and require the patient to spend some time in the hospital. And the third and least invasive option includes using bronchoscopy, which is a procedure where a camera is directed to the airways of the lung to get as close as we can to the nodule and be able to sample it. The problem in the past with manual bronchoscopy has been that accuracy is typically been very poor owing to the fact that we're going through the pathways of the lung, and many times the airways don't necessarily take you directly to where the nodule is. More and more lung cancers are now being seen in the periphery of the lung, which means that we have to have better means of doing effective biopsies in the edges of the lung, which requires us to have accurate means of getting out to further and further parts of a patient's chest. So the solution that we've been looking for all these years is a optimized form of bronchoscopic sampling of lung nodules that can marry the accuracy of CT-guided biopsies with the safety of bronchoscopy.
Coming up, how the use of robotics is reshaping what's next in support of early lung cancer detection. We'll be right back. Welcome back. The task of diagnosing lung cancer has become more challenging and complex over the last 20 years with the rapid expansion of treatment options. Let's take it back to Dr. Abedi for more.
As physicians who are focused on the diagnosis of lung cancer, our needs when it comes to the procedures that we perform has changed over the decades as lung cancer has evolved and as our understanding and available tool set for lung cancer has evolved. This makes it very important for us as doctors who diagnose lung cancer to have access to technologies that let us have a better chance of obtaining tissue from these targets so that we can provide as much information as possible to the team that's going to be managing these patients after diagnosis.
When Dr. Abedi was speaking to me about the nodule that was suspect, he was basically just saying that it's in the upper right portion of your lung and that there were 2 different methods on getting this biopsy. One of them was to go through your rib cage, and then he also said that there was another method that could be used to go in through my throat and get the biopsy. So of course I'm going to elect the one that has the least recovery time, and we elected to use the robot. I was released the same day. I went home and spent the rest of the day with my family. Dr. Abedi called me up and told me that the results were in and I needed to come in and speak with him. And he explained to me that it was cancer, and that it was only stage 1 at this moment, but in order for it not to progress, that he recommends that it gets removed, and that would entail removing 1/3 of my lung.
Robotic bronchoscopy is one of these technologies that's created a lot of excitement in the interventional pulmonology community because in the past, The technologies we had access to for diagnoses included CT-guided biopsies that were very accurate and bronchoscopy that was very safe, but the two did not necessarily intermingle. And now we have the ability to perform biopsies that are as accurate as a CT-guided percutaneous biopsy while still maintaining the safety profile of bronchoscopic sampling.
Meet the ION endoluminal system. Created by Intuitive, the ION is a robotic-assisted platform for minimally invasive biopsy in the lung. With over a quarter-century of pioneering minimally invasive care, Intuitive is focused on helping physicians improve the lives of people around the world.
So the ION platform came from a clinical need related to the survival rates for lung cancer. 5-year survival rates are very low, 20-25%. So we wanted to see what could our technology do to help that. With lung nodules, if they're too small, right now with traditional methods, you either cannot reach them to biopsy, or there's a significant complication rate with other techniques of trying to biopsy them. Otherwise, patients have to wait. They wait and get x-rays serially, get CT scans serially until the nodule gets big enough that you can get it with an alternative approach. That must be incredibly stressful for patients to sit there. Do I have cancer? Do I not? How do I change my life? What do I have to do? The ION platform allows a robotically controlled catheter to be able to reach what are otherwise hard to reach nodules. It gives you a stable platform that can be very precise and can go deep in the lung to a nodule that you can't reach otherwise, which will allow them to detect cancer cells, which therefore allows their patients to get intervention. At Intuitive, we started with the Da Vinci, which is really focused on the intervention. The patient already has a diagnosis, and now they need intervention for that diagnosis. And in some cases, they've gone from the use of the ION system, and then they have their intervention with the Da Vinci system in a very short period of time. So then again, they're back to their normal activity much faster than they would have been without the use of the technology.
Dr. Villaverde explained to me, basically, I had the same two kind of options as I did when he ordered the biopsy. You know, you can either cut you open and split you open, or you can use a robot and just have a couple of incisions.
As soon as the doctor presented the solutions, and one was obviously the road to take because it was less damage on the body and you were up and active more quickly, and you had the benefit of technology. And we're talking about super advanced and robotic technologies. And how wonderful that we had a doctor who says, I really like to explore the cutting edge and what is available to address this and what can be done, and not just lean back on it's always been done this way.
About a day goes by, and the doctor comes in and he recommends to have the chest tube removed. And then about 2-3 hours later, he comes back in and says, hey, you know, the additional scans that we did when you were after recovery, everything is looking good. How do you feel about going home? And it was amazing, you know, that less than 24 hours or just over 24 hours, having a third of your lung removed, and they're saying you can go home.
I think our core mission at Intuitive is around identifying clinical needs and then helping physicians and surgeons meet those needs in order to improve the lives of patients. It's part of our DNA, it's what we've been doing for 26 some years, and it's what we will continue to do.
So my prognosis is good. You know, given that only a third of my lung has been removed, I am able to scuba dive. I'm extremely grateful that I no longer have this cancer in my body. So my family and I have trips scheduled for this summer. We're looking forward to our next adventure.
as a physician, there's nothing more rewarding for me than knowing that I was able to make an impact in the life of one of my patients by being able to get them through the process of a potentially deadly disease and help make an impact in how the diagnosis was made and how we got them to treatment. And that's where a platform like ION is really important to me, because it provides me with an opportunity to bring safe and effective procedures for the diagnosis of cancer to my patients, which in the past simply was not an option for us.
For more information on lung cancer screening, as well as the ION robotic-assisted bronchoscopy featured here today, visit lung.org. And as always, you can go to our website, accesshealth.tv. Take care, and we'll see you next time.